When should myeloma treatment start?
So, when do our patients start treatment? So, myeloma is defined by the acronym CRAB, which stands for C for elevated calcium in the blood, R for renal failure, A for anemia, and B stands for bone disease. So, in addition, we've also introduced three new biomarkers that also qualifies for a diagnosis of multiple myeloma. They include a high light chain ratio, presence of more than one focal lesions that we see on MRI, and more than 60% plasma cells in the bone marrow. So currently, if the patient meets any of these criteria, they are considered to have multiple myeloma and they will need full myeloma treatment, which induction, if they're eligible for transplant followed by consolidation in certain circumstances and maintenance therapy.
So the majority of newly diagnosed patients are those that have come to evaluation from a healthcare provider because they have symptoms. They have fractures, anemia, and kidney failure. And on average, we should try to treat them as soon as humanly possible, and much sooner than many patients often get the opportunity to be treated. We would love patients to, if they get diagnosed with fractures, anemia, and kidney failure in the hospital, that they start treatment in the hospital immediately to prevent further damage and to allow recovery of those organs that are damaged. But that's not always the case. Some patients meet criteria for myeloma, sometimes the so-called SLIM criteria, greater than 60% plasma cells, greater than one focal lesion on MRI. These patients, or a light chain ratio greater than 100, these patients have met criteria for myeloma diagnosis, but they have a 75% chance of developing CRAB criteria in 2 years. Those patients, they're different. They're not clinically sick at the time. And so you may have a moment to think about it, delay a bit, think about, is there a clinical trial close? Think about the timing for the patient and try to decide and kind of get your ducks in order before starting treatment. So for those patients, you have some flexibility, whereas those patients who will have fractures, anemia, and kidney failure and in the hospital, you want to get them started right away.
When should smoldering myeloma patients start treatment?
So for patients who need to start treatment, right, I think that timing is really critical. So we don't want to start too early for patients who don't need it. And we were talking about patients who have MGUS or that little bit of M protein, but don't actually have myeloma, or even patients who have smoldering myeloma. You know, that we have categories of clinical symptoms and clinical tests that we can look at to call someone high risk smoldering or, low risk smoldering. And what smoldering really means, or asymptomatic myeloma, is that patients don't have organ involvement yet. And so we want to treat patients before they have organ involvement because we don't want them to have broken bones or kidney issues or anything. We also don't want to treat too early that they're going to do really well for many years already before we're going to start treatment, because with each treatment, we cause resistance, right? And so there's a big push to find those patients that really are high risk, that they're about to have myeloma that's going to cause clinical issues, that we should treat those patients, before it becomes that way. So I think for most of my patients, we actually talk about clinical trials if someone has a smoldering high risk phenotype. And then if they're interested, we go ahead and, do that. As a standard of care, we have lenalidomide treatment right now as the one FDA approved treatment for smoldering high risk patients. I think that the question, is, do you want to take something right now, or do you want to watch it very carefully? And then the second we see that it's becoming myeloma, go ahead and start full therapy then, right? So I think the fact that we have something as a standard of care, but most people aren't using it yet, is because of this angst of are you really going to have myeloma in 2 years or 5 years or 10 years? And do we just want to watch it very carefully? So I think that's the most important part, is that yes, we want to treat you before you have clinical symptoms that are causing quality of life issues. However, we don't have the best tools to know which patients that really need it right then and there. So that discussion with your doctor is really important. And if you do have high-risk smoldering myeloma or asymptomatic myeloma, making sure that you're being followed regularly, not once a year, not even every 6 months, but maybe every 3 months, really keeping a close eye on those labs. Because if they're going up, that means we probably go ahead and start treatment.